And as students head back into the classroom, vaccination rates remain relatively low among children and teenagers. In the Finger Lakes region, only 42% of children ages 12 to 15 have been fully vaccinated. Allie Peters joins us now in studio with why health experts say now more than ever it's important those vaccination numbers go up. Allie.
Adam, last year transmission of COVID-19 remained relatively low in schools thanks to masking and social distancing. But things could change a little this year because we have a much more contagious variant spreading around and many students who have yet to get vaccinated. COVID-19 transmission in schools wasn't a huge issue last year, but this fall, the Delta variant is adding some concerns.
Because last year, the strain was not nearly as infectious as the Delta variant. The Delta variant is 4 to 5 times more infectious.
At least 1,000 schools in 35 states have already had to close for in-person learning due to the virus.
So that's why it's all the more important that we follow all the rules and things that we've set out that we know work. Like masking, like social distancing.
As the school year begins, many kids have yet to be vaccinated. According to the Finger Lakes Vaccine Hub, 42% of kids ages 12 to 15 have been fully vaccinated in the region. In counties like Genesee and Wyoming, only 23% have.
There are certain areas that are definitely less uptake than others in certain demographics. Some of it's been in the rural population, some of it's been in the minority population.
So why is this? Doctors say some families are worried about possible side effects and they want more research. But experts say any side effects would show up quickly.
After that 2 or 3 month window, there is nothing more long term. So anyone who's like, well, I want to see the long term side effects, we've seen them. There's millions and millions of doses being administered in this country. We know what we're seeing.
For those under 12 who still can't get the shot, experts say the best thing you can do to protect them is to get vaccinated yourself. Now, if your child does catch COVID-19, experts say most kids are asymptomatic or have very mild symptoms like a cough or a cold. But they remind parents, whether vaccinated or not, kids do have to isolate if they test positive. Live in the studio, Allie Peters, News 8.
Allie, thank you. Currently in New York State, 43% of children ages 12 to 15 are fully vaccinated. This is well above the national average, which stands at roughly 33%.